Ready to go.
Perfect. So good morning, everyone. My name is Maggie Dixon. I am the Home Visiting Coordination Initiative Development Coordinator here at Prevent Child Abuse New York. This webinar is offered as a component of the HVCI. I'm here to just give a couple housekeeping items and introductions as people filter in. I'm watching my participant list steadily increase, which is very great to see. First things first, we do have closed captioning services on today's presentation. If you head to the bottom of your screen and hit show subtitle, you'll be able to see those captions. Secondly, this meeting is being recorded. The first meeting was recorded as well, and they will be posted on our HVCI website. We actually record the meetings and stick them on a dedicated YouTube channel that Prevent Child Abuse New York runs and link them from the website. I'll pop the link to that in the chat, but you'll also receive information about that in the follow-up email as well. Also in your follow-up email, you'll receive a copy of the PowerPoint and a link to a survey. So the HVCI is funded by the New York State B5 PDG grant, and a component of this grant is data collection. So it would mean the world to us if you could fill out the survey after this presentation with some information. It helps us with the feedback and helps us with our partners as well. So today we are joined again for part 2 by Bonnie Allen. She's the Professional Education Administrator for the Office for the Prevention of Domestic Violence. She joined us last week to talk about recognizing and responding to domestic violence for home visitors. And this week, I believe we're going to get more into specifics, particularly for how to do this kind of in the virtual environment and with specific populations as well. Prevent Child Abuse New York is very pleased to work with OPDV as partners, and we look forward to the session today. So Bonnie, please take it away.
Good morning, everyone. I'm glad that you are all here with us today. And I am assuming that many of you were here for part 1. So I'm going to do a brief review of part 1. And then we're going to go into the content for part 2. So if you didn't already introduce yourself in the chat box, please do that. And Maggie's going to be keeping an eye on the chat for me. So if you have any questions, feel free to put them in the chat. If we have, as we're going along, I can address questions, but we do have a lot of material to cover, so it might be better if we wait till the end. But if you have something pressing, please just put it in the chat box and Maggie will let me know and I'll answer it. And there is going to be time available at the end for questions as well. So today we're going to be talking about recognizing and responding to domestic violence for home visitors. Like Maggie said, this is part 2 of our presentation. In part 1, we talked about the power and control dynamics. We talked about how abusive partners may present, what some indicators might be that someone is an abusive partner. And we also talked about what some indicators might be that someone is a victim of domestic violence. And we also talked about how children are impacted by living in a home with domestic violence and what some of the indicators are that children have been impacted because of domestic violence. We also talked about promoting healing and safety for families and the ways and the roles that home visitors can have in that. One of the things that I think is so important for everyone to remember as you're working with families and going into homes is you could really be that one person that really makes a difference in that family's lives. You could be the one kind of lifeline for a victim who they might have. Once they build trust and comfort with you, that they confide in you, you may be able to help them access resources. So I can't stress enough the important role that you guys can have for the reason that you're there, right? Promoting maternal, child, infant health, but also you can really play an important role in helping victims recognize that they're living with domestic violence and helping them get to services. In part 2 today, we're going to talk more, so we kind of talked about how do you identify it, and now we're going to talk more about how do you talk about domestic violence, how do you ask about domestic violence, how do you screen for domestic violence. We are going to talk about some of the additional challenges and barriers that specific populations have that are struggling with domestic violence, and today we're going to also talk about collaborating with domestic violence service providers. One of the things I think that's really important for everyone to know is that every county has a domestic violence program, and those programs have 24-hour hotlines and a whole host of services. So we're not asking that you be the expert in domestic violence. We're trying to give you some skills so that you can recognize it and respond appropriately and get in domestic violence service providers for the family when that's what they want, and kind of help make that connection for people. So my name is Bonnie Allen. I am the Domestic Violence Program Administrator at OPDV, and I come to this work with 30 years of experience working with families, individuals, and systems. I've worked with victims and their children in domestic violence, residential and non-residential services in Nassau County, and I did a lot of work in Dutchess County with families. And every family, you know, at whatever program or area I've worked in, even if it wasn't a domestic violence specific program, many times it became apparent that many of the families that we were working with, whether it was in a reentry program or a mediation center, working with families and individuals that are incarcerated, doing parenting classes, and all of the kind of different jobs I've had, many of the people and families that I've been working with, it has come to be known that they have in the past struggled with domestic violence, or that they're currently struggling with domestic violence. So I've had the privilege of really seeing this issue from all perspectives. I've worked with offenders, I've worked with children, I've worked with victims, and in Dutchess County, I was the Universal Response Coordinator. So I got to work with all of the systems that address domestic violence and really helping those systems to coordinate and collaborate and work together. I did run a program that put volunteers in homes to help families become self-sufficient. And so I am very familiar, after running that program and supervising those volunteers and being in and out of people's homes, of the real true benefit of getting to know people and be in their homes, and the privilege of that. And also to be very aware of what some of the challenges and difficulties are about that. So I've come to you today sharing this information with that background. I want to point out that today's topic, we're going to be talking about domestic violence, which also includes sexual assault, and these can be really difficult topics for people. So I really want to stress that if anyone's having a difficult time with the material, if anyone, is triggered, if anyone is reminded of their own personal experiences with domestic violence, or maybe a family member that's experienced domestic violence, this is the New York State Emotional Support Helpline. And also, please feel free to put in the chat if you feel like you would like to talk to someone, and we will do everything we can to support you. And this number is a great resource for you as well. So our office is the New York State Office for the Prevention of Domestic Violence. And our mission is to improve New York State response to and prevention of domestic violence, with the goal of enhancing the safety of all New Yorkers and their intimate and family relationships. Our office, OPDV, is the only state in New York is the only state in the country that has a executive level office dedicated to addressing domestic violence. So we are really proud of that and proud of the work that we do. Our administrative offices are in Albany. We have approximately 30 people on staff, and our mission is to respond to and prevent domestic violence. I encourage everyone to go to our website and check us out there. And also we have Twitter and Facebook. So all of those resources will be available to you in the resource guide at the end. Our focus and priorities are public policy. We focus on key priorities and initiatives that center on domestic violence and sexual assault. We are very aware of the pervasiveness of domestic violence and how everyone can play a role in preventing and responding to domestic violence. We work and strive to make sure that we are connected and that's to domestic violence service providers. There's a provider in every county, at least one, and we work to make sure that those services are always up and running and meeting the needs of victims in their communities. we work with local and state leaders to identify policies and practices that will ensure safety from the prevention of domestic violence. We provide training and public awareness to a wide variety of audiences, healthcare professionals, law enforcement professionals, child protective service workers, social service workers. So if anyone is interested in education and public awareness, we try to meet those needs and provide that education and information. We also think it's very important to look at domestic violence holistically, and therefore to look at all of the other issues that domestic violence intersects with. So oftentimes we're looking at how domestic violence intersects with child abuse, mental health issues, substance abuse, and we're really trying to look at how all of those problems and issues can interact and be present at the same time, and to make sure that they're being addressed as each individual problem, but also recognizing the interplay between all of them. New York is really moving towards a survivor-centered model. We believe that any agency or program that provides services to victims needs to recognize survivors' right to self-determination about their safety and future. We believe that programs need to respond to and advocate for the expressed needs of survivors, and programs need to understand survivors' experiences are affected by the intersections of class, race, ethnicity, age, sexual orientation, gender expression and identity, and geography. And it's critical that all services to domestic violence individuals, sorry, I'm having a hard time with my words this morning, are confidential, accessible, of high quality, and flexible to meet the needs of survivors. It's really critical for domestic violence victims that oftentimes their power has been stripped away from them. They have not had the ability to make a lot of choices and decisions on their own, or to control their own lives or their own paths. So it's critical that when we're providing services to this population, that we empower them to make their own decisions, make their own choices, and respect what it is that they're telling us they want and need, and to work towards helping them meet their goals. This is the definition that we use for domestic violence, a pattern of behavior used by an individual to establish and maintain power and control over their intimate partner. The behavior includes abusive tactics, threats, and actions that may or may not rise to the level of criminal behavior. So it's threats and actions. It doesn't always have to be physical abuse or sexual abuse. Many times, some of the most severe domestic violence and that has the most power and control over victims is not criminal behavior. It could be that someone is really capable of controlling their partner or their victim without ever using physical violence. They can use financial abuse. They can use technology abuse. So it's important to recognize that it's not just physical acts, that it's the threats and the actions that allow someone to have power and control over the other. We're going to review again briefly some of those tactics. We're not going to spend a lot of time there because we did that in part one, but I do, for anyone who wasn't here in part one, I just want to go over that quickly. And so the tactics may include physical, emotional, financial, and sexual abuse. Whoops. So this is OPDV's Power and Control Wheel. We adapted it from the Duluth Power and Control Wheel. And we really just see it as updating that original wheel. And the reason that we wanted to do that was we really wanted to include cultural abuse. We wanted to include spiritual abuse. We wanted to include stalking, and especially the technology abuse. So often now abusive partners use technology in a variety of ways to control their partners, whether it's using the GPS to stalk them, whether it's reading their text messages, whether it's setting up like spoofing phone calls so they can call and get information. There's all kinds of ways that abusive partners use that technology. So we really felt that it was important to have that on the wheel. And we also wanted to acknowledge that any type of privilege can be used as a way to gain and maintain power and control over a person. In the past, the wheel said male privilege, which of course is still a tactic, but people can use their financial privilege. They can use all kinds, but whenever one person is in a position of power over another, they can use that as a tactic of power and control. So identifying domestic violence. This is kind of a review from what we talked about last week. We talked last week about, how do you identify domestic violence? What are the flags? And so we talked about behavioral cues, and we talked about really paying attention when you're working with a family, when you're in the family's home. How are people behaving? How is the victim or possible victim behaving? How is the possible perpetrator or abusive partner behaving? It's really watching people's behaviors, watching their interactions, observing that behavior, observing the children, and kind of noticing, does one person seem to have power and control over another? Does the children's behavior change when one parent is there or not there? Does everyone suddenly seem very quiet when mom is in the house, and when mom's not in the house, people are running around and having a good time? It's really important to pay attention to changes in people's behavior based on who's around. If you go to a home and the person that you usually meet with is always very engaging and chatting and talking with you and pleasant and open, and then you go back 2 weeks later and their partner's there, and they appear to be very awkward, very uncomfortable. They don't really want to have a lot to say to you. They're kind of anxious to push you out of the house. That may be an indicator that it's not safe for them to talk in the presence of that person. So that's behavioral cues. Environmental cues, again, I think we talked about this last week. Are there is there a hole in the wall that wasn't there before in the past? Is something broken that maybe wasn't there before? Is there a piece of furniture that's no longer missing? Is the windshield of the car shattered? Are they mentioning any property damage, or their cell phone is broken? Those are all things to pay attention to, because again, they could indicate that the abusive partner has destroyed property in some way. And abusive partners destroy property. It can be a threat. It can be, look what I can do to this sofa, this wall, you're lucky it's not you, next time it might be you. So damaging and destroying property can be a real way to instill fear in victims. And again, for children observing that, it can be terrifying. So paying attention to environmental cues is really important. Unexplained injuries. If you notice, and again, all abuse is not physical, so obviously this is just when there might be physical abuse happening, but if you notice that someone has a bruise, or it's in the summer and they're wearing a scarf around their neck, maybe to hide marks that they've been strangled. If they have any bruising, any place where they're trying to cover up anything, if they, have a broken arm and they tell you that they fell down the stairs, all of those kinds of things are just things to pay attention to. Now, every injury doesn't mean domestic violence, obviously, but again, you want to pay attention. And if particularly there's like bruises in different stages of healing, or you're noticing really regularly that there are these unexplained injuries, and they're maybe uncomfortable talking about them, again, that's something to pay attention to. Emotional cues. So we know that living with domestic violence as a victim, or as children, experiencing that in the home, people maybe start to appear very anxious. They may become depressed. They may not have a lot of energy to do things. They may not be able to keep up their home in the way that they normally would, or their appearance. If you notice that one parent in the house is always angry, or seems unhappy, or jumps down people's throats, all things to pay attention to. Kind of what is the mood in the house, and paying attention again to everyone's, not just their behavior, but their mood and their attitude. And then of course, statements. You will hear things, victims may say things like, well, my partner's really jealous sometimes. Or children may say, well, we're not allowed to do that when, daddy or mommy is home. Or sometimes mommy gets really angry, or, well, sometimes my partner really doesn't want me to see my friends. So just paying attention, remembering those tactics, and really paying attention. Am I observing any tactics? Am I hearing things that indicate that there may be domestic violence in this home? So really just paying attention. So I want you guys to use the chat box for this question. Why is it sometimes uncomfortable to ask about domestic violence? So if you could just take a moment and put in the chat, why sometimes it's difficult to ask or doesn't feel comfortable. And Maggie will read some of those responses to me, and we will talk about them.
I'm getting a couple responses. It's personal, afraid to talk about it, fear to offend, the shame associated, privacy, respect for privacy.
Perfect. So that is exactly what is on my next slide. So, and there was actually has been some research done that really talked to home visitors about, you know, what are your concerns when you're working with families related to domestic violence? What makes it difficult to talk and ask about domestic violence? And so what they found was that sometimes people's lack of knowledge, like they feel like they don't have the understanding of domestic violence. And so there's a concern about bringing it up and talking about it. So that can be one thing that's really difficult. And if you feel inadequate to address a problem, and particularly if it's a problem that you feel could be dangerous for you or the family that you're working with, so sometimes people don't want to ask because they're afraid, I'm going to ask, and then what am I going to do? How am I going to respond? Is it my job then to keep this family safe, to get them to services? So sometimes a lack of knowledge about domestic violence and a lack of knowledge about the services that are available can make it uncomfortable or difficult to ask. The other thing that they found was personal feelings related to domestic violence. Again, because domestic violence is so pervasive and so many people have personally experienced it, whether as a victim or maybe knowing someone, having a friend, a child, a family member, maybe knowing someone who was incarcerated for domestic violence. So people often have personal connection to the issue of domestic violence. And so sometimes those feelings can get in our way of our biases crop in based on our experiences. And we may feel, again, that that's personal business, or that I don't really know what's happening there, so I'm not going to ask. Or I tried to help my niece for 3 years and she never left, so I'm not going to ask because it's not going to make a difference. They're not going to leave. Or I'm going to ask and I'm going to really insist that this person does leave and get safe because I know someone that was seriously harmed. So it's very difficult when we have personal connection to domestic violence, which many of us do, to kind of separate out our biases, our personal feelings. And so sometimes, and again, if it was a really difficult or hard experience, we may just want to avoid dealing with that altogether. So that can be another reason why it's difficult or hard to ask, or that people are reluctant or hesitant to engage in that conversation. So personal feelings, personal history, and then I think people said fear. And fear is, I think, really oftentimes the biggest one. And so what is that fear about, right? And I think it can be about a whole bunch of things. One of the things when I've done this topic of conversation in workshops or meeting with people is that they're really afraid that they're going to lose their connection or relationship to the family. They may think this is a personal issue. I'm in this home. I'm able to really support and help this family, and they're really achieving goals, and this relationship is really beneficial to the family. And if I now start asking about domestic violence, are they going to not welcome me in? Is it going to be uncomfortable? So oftentimes I've heard people say, like, I'm afraid to ask because I don't want to make things worse. I don't want the person that I'm asking to be embarrassed or ashamed or feel bad. And some people may say, well, why would a victim feel bad about that? We know that victims oftentimes feel ashamed or embarrassed that they are living in that situation. And sometimes they will take on the blame themselves. So what I've heard a lot, and what the research really tends to show, is that there's this fear of losing connection with the family, fear of embarrassing the family. And also there's a fear of how are you going to address this when the abusive partner may be present in the home? And, you know, is it safe to even bring it up? And what's going to happen if I bring it up? So I think there are lots of reasons why it can be difficult or hard to ask or uncomfortable to ask. So all of that being said, I'm going to encourage you to ask and talk about domestic violence, because I think if we can identify ways to do that safely, and in ways that can feel comfortable for you as the home visitor and for the family that you're talking to about this, I think it can make a really big difference in getting people the support and help that they need. So you're not, you know, we're not going to say, like, walk into the house and say, so is there domestic violence going on in this home, right? Everyone's going to deny that. They may not even recognize that there's domestic violence going on in the home. But what we want is for you to start to build rapport and trust with the family. And that's every member of the family, right? The adults in the home, the children in the home, really start to build relationships and trust and engage with everybody, right? Engage with both parents, engage with the children. You can start by asking simple questions about their relationship. How long have you been together? You know, do you guys get along well? What are the things you enjoy doing together? Making it comfortable and establishing that those are questions that are okay to ask and talk about with the family that you're working with. After you can then start to observe and comment on the relationship. Oh, I noticed that your partner's really, really great with spending time and playing with the kids. Or, oh, I noticed that your partner's never really home and a lot of the child care falls on top of you. You can start to observe things, positive things, things that may be negative. You can start to ask questions. Again, as you build that relationship and rapport, you're going to be able to comment and ask about the relationship. They're going to start to feel comfortable with you, and then they're going to confide in you. And we want you to provide information, right? Why would you be asking them about their personal relationship? Well, their personal relationship impacts the children. It impacts the health of the family. It impacts everyone's health and well-being. And so providing that information, providing information about what healthy relationships are, what they look like, how children benefit when the relationship is healthy, and how children suffer when the relationship is not. Helping them be aware of, you know, that children oftentimes are seeing and hearing and very aware of what's happening in people's intimate relationships. So when we sometimes I think what we do is we think, oh, I asked about domestic violence, or I had a screening tool and I said, is there domestic violence in this home? And the family says no. And so you check that box and then we move on. There's no domestic violence in this family. That's really problematic for a lot of reasons. We know that, again, if you haven't built that rapport and trust, they're not going to tell you if they're a victim of domestic violence. If you haven't taken the time to establish that relationship, they're not going to tell you. They may not recognize that they're a victim of domestic violence. When you start working with a family, they may not be a victim of domestic violence. And a year later, maybe they're in a new relationship and it turns out that that's an abusive relationship. So we want you to ask periodically about domestic violence. So it's not a one and done kind of thing. We want you to ask about domestic violence, talk about domestic violence. If you have screening tools that you're required to use, we would never tell you not to use those screening tools, but it can't be I asked once and now we know that there is or isn't domestic violence in this home. So we want you to ask periodically. We always want you to ask privately. If you cannot ask or talk to the person that you suspect might be the victim privately or alone, it's better not to ask. It can be really, really dangerous for victims to talk about this, or even if their abusive partner were to overhear you asking about their relationship, the abusive partner most likely isn't going to be angry at you for that. They're going to be angry at the victim, and they're going to blame the victim. You know, why are you talking to them about our relationship? Why is she in here? You really need to ask privately. And that goes for not asking even in front of the children. We know that abusive partners will really manipulate and use children to get information, to make children, provide them with information, to quiz children. Even if the victim says, you know, oh, this is my mom, you know, she's, you know, it's fine for us to talk in front of her, you know, I feel really comfortable. For all we know, her or their abusive partner may have said to them, you know, my mother's going to be in that room with you, and you better not talk to that home visitor without my mother in the room. And so then what's the victim going to do? They're going to say, oh, of course it's fine to have this person here. So it's really critical to interview privately and routinely. So one of the things that can be difficult is, how do I bring this up? And so one of the things that we recommend, particularly when we work with healthcare providers, is because so many of the families we work with experience domestic violence, we ask all of our families if that's ever been an issue or a problem, and we just want people to know that if it ever is an issue or problem, we can help you out and provide resources. They don't need to at that point acknowledge or not acknowledge, but you've given them some really important information. So you want to ask routinely, right? And you want to ask more than once and throughout your relationship with the family, always privately. It can be difficult to, because of all those reasons that it can be uncomfortable, it can be difficult to figure out how am I going to ask, what feels right for me. And it may be that with one family you'll ask in one way, and with another family that you have a different relationship with, you may ask a different way. So really kind of practicing and kind of feeling what feels comfortable for me. How does it feel best for me to ask about this? And always assessing, you know, is it safe and what is the right time? And you always want to go over the guidelines with families. If there's issues around child abuse reporting or any limitations to confidentiality, you want the families that you're working with to know and understand those before you're having these conversations. We want to avoid any questions that are labeling, are you a victim of domestic violence? Many people will not recognize themselves as a victim or don't want to see themselves as a victim. So really talking more about the relationship, and it's common that people experience power and control in their relationship or abuse in their relationship, or sometimes people are afraid of their partners sometimes. So really kind of playing with the language and feeling, you know, what feels comfortable to you. And it may be different with different families. So we have a polling question now, and I think Maggie will put that up, and we're going to ask that you take a minute to do the polling question, and then we'll talk about the answers.
Are you able to see the results as they roll in, Bob?
I am, and we have very strong responses that the answer is all of the above. And that is the correct answer. So we can look at those answers. Do you end the poll, Maggie, or can I? Okay.
There we go. I've got that. And those are the results.
Yes. So overwhelmingly, 95% of you agree that E is the correct answer. So let's look at this, what the question is, and take a minute to look at it. Why do victims and children not to, I can't, it's blocked by my little screen and it's not letting me click on it. There we go. Why do victims and children choose not to tell home visitors about being abused? So they want to protect their abuser from consequences. Now, sometimes people would think, why would they want to protect their abusive partner? Why would they want to protect the person that's harming them? And so it's really important to recognize oftentimes the person that's harming them, right? It's their spouse, it's the person they love, it's the person they've had an intimate relationship with for sometimes 5, 10, 20, sometimes 50 years. We know that abuse happens among the elderly and elderly couples. And so although victims want the abuse and the violence and the power and control to stop, oftentimes they don't want their abusive partner to be harmed, to be incarcerated, to have legal consequences that might bring financial issues onto the family. So oftentimes, even though victims definitely want the abuse to stop, they do want to protect their abuser from consequences that may impact not just their abusive partner, but the entire family. Oftentimes, I think we talked about this last week, so we won't spend a lot of time on it, but oftentimes victims feel responsible for the abuse and they feel ashamed. They have often been told by their abusive partner that this is all their fault. And if they just behaved differently, the abusive partner wouldn't have to be abusive. So oftentimes victims, after hearing that, they really buy into that. And so they feel responsible and ashamed. And so they don't want to confide that that's the situation that they're living in. Overwhelmingly, they are afraid of their partner finding out that they told someone. Oftentimes we know that abusive partners will say over and over again, you better not tell anyone, no one will believe you. If I ever find out that you told anyone, I'll kill you, I'll kill the pets, I'll kill our children, you'll never see the kids again. The threats that come with if you ever tell anyone can be very, very powerful for victims. And we've talked about this before, they often don't see themselves as victims of domestic violence, right? We all have these kind of ideas in our head about what domestic violence is. And if our situation doesn't fit what we have in our head as being domestic violence. So for instance, if my partner doesn't physically harm me, or if my partner, you know, yells and screams at me and puts me down sometime, but provides for me and the family and takes the kids on vacations and holidays and is the soccer coach, they may not see themselves as a victim. And so they're not going to confide that they're a victim if they don't see themselves in that way. So thus we come to our answer of all of the above. So it's not letting me advance. Let's see. Yeah, it's just like it's frozen or something.
I'm not sure. Maybe if you, can you just stop sharing and then reshare quickly?
Yeah. Where stop share.
It's on the top of the screen.
Yep, I got it.
Apologize, everybody. Thank you for your patience.
Okay. Oh, now I can't even. Okay, share. Okay. Give me 1 second.
It's going backwards.
Yeah, because we did
this. We just did the polling.
But this isn't the poll question that we just did.
Oh, no, it's not.
That's why I'm confused.
Oh, yeah, you just gotta, oh, wow.
All right, we did this.
We did this.
We did this. This is the one we just did.
Yep.
Oh, so here we are.
Okay, perfect.
Okay, this looked like the other one. That's why I was confused with the blocks. So these are the things that we just went over with the polling question, right? They don't disclose because they're afraid. They're afraid because they've been threatened. They're embarrassed. They want to protect. And again, it's not just protecting their abusive partner. They want to protect themselves. We know that oftentimes when victims seek help or make moves towards getting out of the situation or leaving an abusive situation, that they're at their most dangerous time. And so it's that they may want to protect their abuser, like we just talked about, but they also want to protect themselves and their children. And we all think, or frequently we think, right, that leaving is the way to do that. But what we really understand and know more and more from listening to victims is that sometimes the way to protect themselves is to stay and figure out how to navigate that, or to plan to leave if that's what they want to do, in ways that are safe. So just kind of fleeing the home sometimes is actually more dangerous for victims. And again, we talked about them not knowing. And I think this is another important one, right? You're a home visitor, and if you're new to their family, and if they've had any negative experiences with any systems at all, no matter how well intentioned you are and how you come to that family, there may be some initial distrust of you. And so they're not going to confide the things that they're most embarrassed about or most afraid of or most ashamed to you in those initial early contacts. Some will, because that's what some people do. But the majority of people are going to wait. They're going to say, is this person someone that I can trust? Is this person someone that I can confide in, before they start to tell you about their most, painful and intimate things about their relationship. So here we have another polling question. So screening for domestic violence, and then if you can use the poll. I think too, when we talk about fear for victims and why they don't disclose, it can be fear of losing their children, fear of losing their marriage or their relationship, fear of the abuse escalating. When you really start to think about all of the reasons why a victim might not confide in someone, the reasons really can be overwhelming and overpowering. So it looks like the majority of you are choosing should not be done in the presence of anyone other than the program participant.
And we'll go ahead and end this poll and share the results.
Okay, so the majority of you said a screening should not be done in the presence of anyone other than the program participant, and that is 100% accurate. I can't stress that enough, that you really need to make sure that person is alone before you're having these conversations with them. And the correct answer is all of the above. And so I'm going to go through each of those and talk about why the other ones are, oh wait, maybe, no, I'm saying the wrong thing. The answer to this one is B, I'm sorry. So B, should not be done in the presence of anyone. So I'm going to close this now. So screening should always be done at intake. Well, it shouldn't be done at intake if at the intake they bring, you know, their mother with them and their 3 children, and they're sitting there and you're going to ask that question because it may not be safe for them to answer it. So we always want to be assessing, is this a safe time to ask these questions? If it's part of your intake process and you have the victim there, you can ask. If they're alone and it's part of your intake process, there's no problem with that. Or if you know it's part of your intake process and you have to ask that question at intake, you want to make sure that there's some part of that intake where you have access to that person privately, and then ask when it's private. And if you can't ask privately, again, better not to ask. So should not be done in the presence of anyone other than the program participant. That is the right answer. Most of you got that right. Is not recommended by most major medical organizations. In fact, screening is recommended by most major medical organizations, the American Academy of Pediatrics, the American Medical Association, New York State Office of Mental Health, substance abuse organizations, American Psychological Association. So screening is really overwhelmingly recommended. And the purpose for that is, right, because we want to identify domestic violence, and we want to identify it so that we can get people the services and support that they need. But again, it needs to be done in a manner that's safe for everyone. Also, we do a lot of training of healthcare providers, and screening is recommended for intimate partner violence during obstetric care and should occur at the first prenatal visit and at least once per trimester and postpartum, right? Because again, your relationship with that person may build over time as the pregnancy progresses or as the child actually comes into the world. The abuse may escalate in the family. So again, screening is really important. It just needs to be done in a way that's safe for everyone. Yeah, after the polling questions, it does not like to advance. So I will.
So odd.
Yeah, I'm trying all options. So I'm going to stop sharing again. It didn't have that problem last time, right?
Oh.
Yeah, I don't know what that's about.
Did you check your buttons on the computer?
Yeah, it was all working before.
Well, if this is the only tech issue.
I know. And then of course me remembering where we were then.
Up a little bit.
So that was the polling question. So we're here. Thanks. So screening for domestic violence. So oftentimes when we think of screening, we think of a formal written tool. Like we have this either on the computer or in front of us, this paper and pen test, and we're going to ask these questions about domestic violence. So and there are lots of those formal written tools that are evidence-based and been tested and evaluated, and they accurately assess for domestic violence. Oftentimes they are used as part of intake, that like we talked about. Frequently they're administered once and then not administered again. And of course people's relationships change, people's situation changes, the level of violence changes. So it's important to do it more than once. And I think it's really critical, if you are using these formal written tools and you are required to do them at certain points, that you're doing it safely, but also that that's not all you're doing. So that's what we really want to talk more about. In addition to, if you're required to use these tools, and again, the tools, I do identify domestic violence. If they're administered safely, there's no reason not to use the tools, but the tool is not enough. So that's why we really want you to establish this relationship and this ability to really talk with the family, so that you're constantly assessing, you're constantly paying attention, so that it's not a one-time thing and it's not only about using that tool. So there are many tools, and you can look into those and research them. There's one called the HITS, which is Hurt, Insult, Threaten, Scream, which is a 4-item test. I personally don't care for the name of it, but that's what it's called. There's a WATS, which is a woman abuse screening tool that has 8 items on it. There's a PBS partner violence screen. So there's a variety of evidence-based, written tools that people can use. But I just want to stress that in addition to that, you really need to be talking and engaging with families when you're screening. Do I have it in slideshow mode, or are you seeing all of my notes?
No, we see the notes.
Okay, so let me fix that. Yeah, my computer's being very glitchy.
Current slide there.
Okay. All right, so a lot of times we think about screening, right? And we think we've done a successful screening if the person that we're talking to admits that they're a victim of domestic violence. And, particularly if we suspect that they might be experiencing violence, then we're looking for them when we're asking and talking and screening, we're looking for them to say, yes, I'm a victim of domestic violence. We also usually want them to, right, if someone tells us they're a victim, we want them to do something, right? We want them to call a hotline. We want them to go to shelter. We want them to call the police. We may have this whole kind of list of things that we think they should be doing. And oftentimes we think that they need to get out of that relationship, right? We think it's dangerous. We think it's unhealthy. We know it's not good for the children. And so I think a lot of times when we think about screening, we think, okay, well, I'm going to ask. I'm pretty sure this person is a victim. I've seen all these indicators. I've seen all these cues. I'm pretty sure that this is what's happening. So I'm going to ask, I'm going to talk, and they're going to tell me that they are. I'm going to get them to connect to services. They're going to leave. And that's a successful screening. And I think it's really, really important that is not necessarily a successful screening. In some ways, that could be a very dangerous screening. We really, when we go back to that survivor-centered idea, right, really listening to what do victims need, what do victims want, what do they think is going to keep them safe. And so what we really kind of want to redefine as a successful screening as what are the messages that I'm giving to that person by asking and talking about domestic violence. So remember I said earlier, you can say something like, because abuse or power and control is so common, or so many people are feeling unsafe within their intimate relationships. However, again, whatever language you choose to use, we ask everyone about that. And I just want you to know that if that is ever the situation, help and resources are available. And I can connect you to that help and those resources. And I'm a safe person to talk to about your relationship. And I want you to feel safe and comfortable to do that. Another really successful screening message is simply letting that person know that you believe them and that it's not their fault, right? They've been told it's their fault. They've been told no one's going to believe them. They've told them there's no help for them. They've told them they deserve to be abused. You're not going to get help. And you better not talk to anybody about this, right? And it may not be safe for them to talk to family or friends. And so we really want to reframe what successful screening is. It's not about someone acknowledging that they're a victim. It's not about someone leaving their abusive partner. Again, if those are things that someone wants to do and you can help them do that, that's really fabulous and wonderful. But we really want you to see a successful screening as you've acknowledged to this person that if they ever are experiencing any of that, you can help, you can talk to them, you will believe them, and that many people experience this, and it's never someone's fault when they're being abused. So you can give all of those messages without that person ever even acknowledging to you that they're a victim. And what you're doing is you're building the likelihood that if you have that conversation a couple times and you insert those messages throughout your relationship with them, if they are a victim and when they are ready, they know that they can come to you. You've opened that door for them. And if they're not ready at the first time or the second time, you never know. Maybe the violence is going to escalate. Maybe something else is going to happen. Maybe the kids are going to get harmed. You never know at what point they are going to want to come to you. And so a successful screening is that you've let them know, I'm here, I'm available, and you can come to me. And I will believe you, and I will do my best to help you. Those are what successful screenings are. So we have a couple case scenarios throughout our presentation. And so I will read it. You can also obviously read along. And then I'm going to ask you to put in the chat box, how would you respond in these situations? So you've been visiting the Doe family weekly for a month now. Jane Doe is 8 months pregnant with her first child. John, her partner and father of the baby, is always present and is very excited about the baby and being a father. He is very involved in Jane's pregnancy and has a lot of questions. He frequently does most of the talking and speaks for Jane. Jane denies any abuse at intake on the screening tool, but you have begun to suspect that John is very controlling and have noticed that Jane is intimidated in his presence. At your next visit, Jane answers the door and says John is not home and wants her to cancel the appointment. She appears very anxious and says John has been under a lot of stress lately and will be very angry if they visit without him. How do you respond to Jane? What do you say to her? You're at the front door. Normally she's welcoming you in. Today, she's not having you in the house. How can you respond? And you can use the chat box to answer that. Maggie, when there's a few responses, you can just let me know.
Nothing yet. I have a couple people saying they would ask Jane, what would you like to do? Would you like to reschedule? Can I assist you with anything?
Perfect.
Is it okay? Do you feel safe?
All excellent questions, right? Because you're asking her, what does she need? What does she want? You're letting her know you care. You're letting her know that you're concerned. You're willing to reschedule, right? Because in the back of your mind, you know what? It may not be safe for you in there right now. And she's telling you that it's not, but you want to check in with her. You want to give her the opportunity. Are you safe? Do you need anything? I think it's really important sometimes to just reflect back. You seem anxious. I'm concerned. You seem worried about John being angry with you. I'm really sorry to hear that John is stressed. What's going on? We don't need to meet today, right? Reassure her instantly, right? If she's anxious about meeting, you can let her know, we don't need to meet today. We can reschedule. I'm really glad that John is involved and interested in our appointments, right? Because he shows up, usually he's there. What would you like to do? How do you feel? What happens when John's angry, right? She mentions John is stressed. She mentions that he'll be really angry if they visit without him. So it's okay to ask, right? She put that out there. Again, we're paying attention to what she's telling us. We're paying attention to her statements and we're reflecting back and feeding off of those. Oh, what happens when he gets angry? I'm sorry, he's under stress. So these are all things you can say, right? Without, pressuring her to come into the house, without insisting that you need to do the visit. Also acknowledging the good things about John. This is an opportunity to build trust and to talk about the relationship, right? And you're opening the door for future discussion. You could even ask, you seem really uncomfortable, or it seems like you really almost seem afraid to meet without John. Jane may want to open up and tell you more, or she may not. But again, you've given all really, really good messages and you've kept the door open for conversation. So safety is obviously critical when you're working with homes where there might be domestic violence. And of course, we need to remember that we don't know, right? Many of the homes that we're going in, there may or there may not be domestic violence. So anytime you're going into someone's home, safety is primary, it's a priority. We need to go into homes recognizing that domestic violence can be in any home. Sometimes we might think, oh, that home is really fancy and really nice. And, you know, the parents are both upstanding community and church members. The kids are always well dressed. We can make assumptions, right? Well, there's no domestic violence in this home. That can be a really dangerous thing to do because we know that domestic violence can truly be in any home. And so we want to always move forward knowing that that's a possibility. We don't want to assume that that domestic violence is impossible in this home or it wouldn't happen here. And again, back to the screening, and we already covered that. So there's a lot of information that's really helpful to have when you're going into people's homes or when you're assessing for safety. Unfortunately, we don't live in a perfect world. So oftentimes information that would be really nice to have, we may not have. But it's important to recognize gather and get whatever information we can, because the more information we have, the more we're going to know about keeping families safe and keeping ourselves safe. So when you get a new case, is there any history of domestic violence in this family? Is there any child abuse history? We know that domestic violence and child abuse often go hand in hand, right? So if there's one, it's likely that the other one might be present also. What's the criminal history of the members of the family? Has anyone been on probation? Has anyone been on parole? Is there an order of protection history, right? Having all that information, those are all, again, clues and cues that domestic violence might be happening in this family, right? If there's a history of domestic violence in the family, it's likely that that domestic violence is still going on if that family is still intact in that way. Is there a mental health history? Is there substance use history? We know that victims sometimes use substances to cope with violence. We know that oftentimes abusive partners are using substances before, during, or after incidents of violence. We know that domestic violence, living in a situation, can cause anxiety, depression. We also want to know, are there any barriers to safety, right? We're going to talk about specific populations. And if you are an immigrant and you don't know the services or you don't speak the language, those are all barriers to accessing services. So it's really helpful to identify as much information as we can. And where do you get this information from? You can get it if someone is on probation or parole, you'll have that. Domestic violence incident reports, the police, Child Protective Services sometimes has that information. You may or may not have access to it, but the more information you have, the more you can assess appropriately for safety. So what can be difficult or frustrating when working with victims of domestic violence? I want you to use the chat box for that. I think we think oftentimes of what can be difficult or frustrating working with abusive partners, and there's a whole list for that, but sometimes it can be difficult or frustrating when working with victims as well. And I think it's important to acknowledge that this is not easy work, and it's not easy work in whichever way you're trying to address it. Do we have anything in the chat?
Yes, many people are talking about difficulty building a trust in the relationship.
Absolutely.
When there are patterns of victims, going back to
Right.
the abuser.
And I think that can be really one of the most difficult things, right? Maybe someone has confided in you, they've told you that they're a victim, they've asked for help, you've provided resources, maybe they even left, and then they go back, right? And you feel like you've invested all this time, all of this energy, really helped this person, and then they go back. So that can be really, really frustrating. And we're going to talk about that, and hopefully gaining an understanding of why sometimes people go back might lessen the frustration a little bit, or at least it helps you be aware of what's going on. Anything else in the chat?
Having a fear about safety, that the client can get hurt, worried about children.
Absolutely, right? It can be really difficult if you're worried about the safety of that family and you want the victim to do something. It can be very frustrating, right? Why aren't they leaving? Why aren't they calling the police? Why aren't all of those kinds of things? And you can get frustrated with the victim. And oftentimes it's the victim, right, that we're interacting and seeing with, and the abusive partner we're not, right? And so sometimes the focus gets on what is the victim doing and why isn't the victim changing? And it shifts off of why is this person being abusive? Why is this victim in the situation that they're in? So it can be difficult. And I think it's really important to really think about and understand all of the reasons why victims behave in the ways that they do. And usually they behave in the ways that they do to protect themselves and their children. And almost always their motivation for whatever they do is to keep themselves and their children safe and protect their family. So oftentimes victims struggle with, if I stay, I may continue to be abused. The abuse might escalate. If I stay, my children might be safer. I don't want to take my children to another place where I don't know people and I'm living in a strange situation and they don't have their school and they can't see their grandparents. So if I stay, my children might be safer. If I stay, I might be abused. If I stay, the violence may escalate. If I stay, I may lose the support of my family, right? They may have family pressure that's arguing with them. Why are you still there? Family members with good intentions can put all kinds of pressure. And sometimes their own frustration with the victim doesn't then cuts them off from the victim. And then that's exactly what the abusive partner wants. The victim is more isolated. If I stay, my children might be angry, right? Why are you staying when you know, mommy or daddy is so mean or hurts us or hurts you? So these are all things that victims consider when they think about staying. And if they leave, they have to think about all the same things. If I leave, I may be abused. My children might be safer. The violence might escalate. I may lose my support of my family. My children will be angry. It's not as simple as I leave, all these good things are happening, and if I stay, all these bad things are going to happen. Very frequently, the struggle that victims have is figuring out what is the safer option. And for many, many victims, neither of those options is particularly safe. And there's a lot of unknown. So they're always struggling with what is the way to keep myself and my children as safe as possible. And there are not easy answers to that questions. And so I think if we can remember that victims are always struggling with how do I stay safe, that maybe it's a little less frustrating if we can understand the struggle that they have, right? To stay safe, victims stay in the relationship, right? We know leaving is the most dangerous time. They leave the relationship, okay? I can't handle this anymore. This is bad for my kids. I'm gonna leave. Oh my God, I've left. I don't have any finances. I don't have any resources. I can't see my family. They have unsupervised visits with my children. I better go back. So they return. They call the police because there was a physical incident and they were harmed, and they say, I can't do this anymore. This is dangerous. I need law enforcement to come in and help. They don't call the police because if they call the police, then their partner's going to be really, really angry. And if their partner gets incarcerated, then what? There's no income for the family, maybe. Maybe there's no childcare for the children. So they don't call the police. They get an order of protection. They don't get an order of protection. What I want you to start to understand is that for victims considering how to stay safe and protect themselves, there are no easy answers. And on one day, what might keep them safe, on the next day might cause them harm. What might work well for one victim to keep them safe may be the most dangerous thing in the world for another victim to do. So it's really important to kind of keep in mind what are the struggles that the victim is facing, and going back to that survivor center model, really listening to the victim and asking what do you need in your situation today, because that can change, right? They may ask for help to stay safe. They may refuse help to stay safe. They may get a job to stay safe. They may have to leave a job because their partner is harassing them at work. And so we ask, you know, who's the best person to determine how that a victim can stay safe? Is it us? Is it the home visitor? Is it the police? Is it a therapist, a counselor, a parent? I think what we need to remember is that the victim has the most connection to that abusive partner. They know their situation more intimately than anyone else. They know and can read the abusive partner's behavior. And so we need to always trust victims. If they say something is not safe or one thing is safer than the other, we really need to respect that and respond to that. We need to really listen to what the victim is telling us and then support the choices that they want. We talked earlier about empowering them to make choices. This is how we do that. We listen to them and we respect what they know about their situation and their partner. So you always want to make safety a priority. You always want to take victims seriously. When the victim is open to it, you want to refer to domestic violence services. You want to get the support. The victim can use the services. Home visitors can call a domestic violence hotline. There's 24-hour domestic violence hotlines. As a service provider, you can call and say, I'm working with this family. I'm really concerned about X, Y, and Z. What is the safest way for me to respond? Allowing victim to make decisions, and again, discussing confidentiality. We've talked about those. We've talked about these three things. I think we've really covered the don't interview in the presence of others. Don't tell an abusive partner what the victim is telling you or even what the children told you. Anything that you say to that abusive partner, and again, you want to engage with them and that's important, but you don't want to say, you know, oh, your partner told me this, or oh, your children mentioned this. That can really put victims at risk. And you don't want to make assumptions about behavior. You don't want to make assumptions about victims' behaviors. You don't want to make assumptions about perpetrators or children's behaviors. What might look like one thing, the motivation for that behavior could be completely different. So it may be that every time you show up, the person that you think might be abusive is the most friendly, kind, on the floor, taking care of, playing with the kids, taking care of the kids, you know, bringing everyone a cup of tea. That behavior may not be because they're the greatest person in the world and so kind and loving. It may be because they want to convince you of that, right? They want to be sure that they're aligning with you. We talked about that last week. We want to consider not just the safety of the victim and the children, right, but your own personal safety. What are the policies in place that your agency has to keep you safe? Do you go to home visits alone? Do you not go to home? You know, do you take someone with you? Do you call in the car before, you know, before you go in to let that family know that you're there? Always keeping your own personal safety in mind. Every time you go into a home, where you decide to sit, who you decide to talk to, the conversations, you need to always keep in mind, is this safe? If there's domestic violence in this home, am I doing anything to compromise anyone's safety? And again, you want to, in addition to your safety, the victim's safety, the children's safety, any relatives or family members that live there, and even the abusive partner. We know that if the abusive partner, right, if they're on medication, if they're taking their medication, if they're taking care of their health, if they're not using the substances that they use, right? If they're safe, then the family's more likely to be safer. Never a guarantee, but certainly safer than if they're not taking their medication or they are abusing substances. And again, your own personal safety. A safety plan is something that you can work with a victim to develop if they've confided in you that they have safety concerns. It's a personalized, practical tool that can help a victim prepare for and respond to dangerous situations. And so safety plans can look like a whole lot of things. It can be helping victims identify options if violence increases, or if they feel that there's a new threat or something that they're really concerned about. It can help them prepare for a crisis. It can help them reduce harm. I mean, it can really be awful to teach someone how to protect their head or to hide in the bathroom or to not be in the kitchen. All of those things sound awful, but they can really reduce harm that's done if there is violence. So those can all be parts of a safety plan. If someone does want to leave their abusive partner, helping them plan to do that and prepare to do that in the ways that are safe. And sometimes the safety plan is the victim is not leaving their partner. And so you can help them figure out how to stay and be as safe as possible. And when talking about safety, you want to ask victims, what have they done previously to stay safe and reduce harm? What are any particular barriers they have to safety? Who's helped them stay safe in the past? Who can help presently and in the future with their safety? And where are safe places for them to go? You can encourage them to tell others and ask people for help. You can help them identify safe places for children to leave the home or hide if violence or abuse erupts. You can establish code words with neighbors, children, family members, even a home visitor, right? If I say this word, it means, you know, don't come, or it means come, or it means call the police. So code words can be part of the safety plan. And identifying kind of what documents you might need if you do need to leave, you know, where can you kind of keep a bag of important things that you might need, extra keys to the car, medications, maybe some cash in case you do end up leaving unexpectedly. So here we have another polling question. So if we can launch that.
Here we go.
Okay, we got 100% correct on that, it looks like, going forward.
Yes.
Okay. All right, so I'm gonna end it. Hopefully it'll let me advance my slides. So all of these things are important. It sounds like all of you are heading in that direction, right? A victim's substance use, immigration status, court system, the tactics that their partner use, all of these things must be considered when you're helping someone plan for safety. Oh, it's so annoying that it doesn't.
I don't understand that.
Yeah, it just. And it takes stop sharing. I don't understand why that's happening. Share screen. I'm getting faster at it anyway. Um, sorry about this. Okay.
Here we go.
So we have another, yeah, it's so glitchy. The mouse doesn't want to work. Okay, so we have another case scenario. I'm going to read through this. And instead of, I'm kind of paying attention to time, and I want to make sure that we get through the material. So we'll do this relatively quickly. Oh, and now you're still seeing all my notes. Okay, so when safety planning,
It's scrolling. I don't know. There we go.
Here we go. Based on observation and private conversations with Jane over the past several months, you are concerned for Jane's safety. She assures you that John will not harm her and that she will just deal with his temper. She does not want to leave the relationship. She tells you that most of the time things are okay as long as she does what he wants. She loves John and wants him in her and her children's life. How do you respond? So if you could put a few things in the chat. Is there anything in the chat?
Nothing yet.
Okay, so just because I'm a little worried about time, I'm gonna move forward. I think here, right, you need to, we talked about really listening to what they're telling you and respecting the victim's wishes. So you can reflect her feelings back to her. You can assure her that you're not gonna force her to do anything. You can acknowledge that she knows how to deal with his temper, but maybe she shouldn't have to deal with his temper, right? To imply that, maybe that's not something you should have to live with. Help her to explore safety options other than leaving, right? If she's telling you very clearly she does not want to leave this relationship, so how can we help her to stay safe while she continues in this relationship, right? Express that you are glad that things are good most of the time. Talk about the ups and downs of domestic violence and how it can escalate over time, right? So this is an opportunity to educate. I'm glad it doesn't happen all the time. I'm glad you feel safe most of the time. But I want you to understand that, when you're dealing with this type of behavior, sometimes it does escalate and sometimes it does get worse. I just want you to be aware of that. Acknowledge her respect and love for John. Encourage her to have a hotline number in case she does, or if and when she is ever ready to talk to someone or seek help or look for support about how to stay. And make sure that she has those numbers and those resources if and when she wants them or needs them, even if she chooses to stay. Talking to her about what happens when she doesn't do what he wants, expressing your concern for her and the children, and talking with her about safety planning and options other than leaving. So certain populations have specific, I'm going to skip over the polling question because I want to move forward. Which of the following could be barriers for safety for specific populations? So fear of being outed. So if someone is in a maybe an LGBTQ plus relationship and their family and friends aren't aware of that, a very powerful tactic can be for their partner to say to them, if you leave me, or if you don't do what I say, or if you don't stay with me, I'll tell everyone that you're a lesbian. I'll tell everyone that you're gay. I'll tell everyone that you're bi. Whatever, whatever the threat is, outing that person can be a very, very powerful tactic in that community. If you have people that are not in this country legally, the fear of their partner being deported, their abusive partner being deported can be terrifying, or the threat that the whole family may have to leave the country could be terrifying. It could be a very powerful tactic for an abusive partner to use. If you have a young teenager who's in an abusive relationship and their parents may not even know they have a boyfriend or a girlfriend, they may have no idea. And so the fear of their parents finding out that they're even in a relationship could be something that an abusive partner could use to maintain power and control. If someone has a disability and they're dependent on their abusive partner as their caretaker, they can really use those tactics as power and control. So in an LGBTQ plus relationship, they may threaten to out the victim, tell their partner that police and counselors are homophobic and won't help them, threaten to alienate their partner from the community that they're both involved in, really go into that community and let them and really talk poorly about the person and isolate them, make them feel bad about their sexual orientation or gender identity or their sexual history. They can run to resources first and then use all those resources, and they can present as a victim. And so then when their abusive partner shows up, they've been labeled as, when the victim shows up, they've already been labeled as an abusive partner. And they may portray the violence as mutual. We know that women of color are particularly at risk of intimate partner violence. Nearly 1 out of every 2 Black women has been or will be a victim of rape, physical violence, or stalking. And Black women are twice as likely as white women to die because of intimate partner violence. So those are, again, really important data for us to know and be aware of, and to really be aware of how biases and racism and ageism and all of those things can add additional layers of complication and barriers for victims of intimate partner violence. People with disabilities are twice as likely to be victims of domestic violence, may be reliant on their abusive partner for everything. And so even harder to navigate and stay safe and get out of a relationship if that's what they choose. And they may not be able to access service. Since immigrants and refugees, their partners may threaten to contact ICE. They may withhold their green card, not allow them to have access to their documentation, threaten to remove the children from the country, create financial dependence, exploit their victims' lack of knowledge of systems and rights and ability maybe to communicate in the language, and prevent victims from knowing and accessing services. So there's a whole variety of populations that may have additional challenges when experiencing domestic violence. And again, if you could just put in the chat box what you think some of those might be. I'm going to talk through them as you guys are adding them. So young people, elderly people, male victims of domestic violence, people who are in the military who may be experiencing domestic violence. Is there anybody putting anything in the chat that I'm forgetting about? People who live in rural communities, survivors with mental health or substance abuse issues, right? So we know survivors are often dealing with many, many additional problems and things that intersect with domestic violence that just make the challenges more difficult. And so it's really important to always empathize with victims, offer them choices, explore options, and keep in mind what their special challenges and barriers might be. We can use Language Line. We can reach out to LGBTQ+ organizations to make sure that we're providing access and support to the families that we're working with. Sometimes faith-based organizations, if an abusive partner is using someone's religion or faith against them, sometimes we can reach out to church organizations and ask for support and help and education, community centers. When you're working particularly with marginalized populations, it can be really difficult to find that additional support that they need. We don't have perfect solutions for these cases, and sometimes it really requires kind of reaching above and beyond to and being really creative to meet the needs of survivors that are dealing with these additional challenges. Debating, I guess I want to go ahead and do this. You have been working with Miaramu, a refugee from the Democratic Republic of Congo. She and her husband, Francois, and 10-year-old son, Lima, were resettled in the US 5 years ago. Francois was very abusive and left the home about 2 years ago. He divorced Miaramu by mail, leaving her unaware of her legal status. Though she believes she is undocumented, as Francois held all their paperwork upon entry in the US. At the time Francois left the family, Miaramu was 7 months pregnant with her now 3-year-old son. She has since become involved with Joe and has a newborn daughter with him. Joe does not live with Miaramu, but shows up expecting to see the baby every few weeks. Joe threatens Miaramu that he will call Immigrations and Customs Enforcement if she doesn't let him see the baby. He also insists on staying over sometimes. You suspect that Francois may be sexually abusive to Miaramu. It's difficult to communicate due to your client's limited English. 10-year-old Lima speaks English well and has told you he doesn't like when Joe comes over. Miaramu is terrified of being deported. How do you respond? So obviously, this is a really difficult case with a lot of challenges and a lot of things to take into consideration. Does anyone have anything they want to put in the chat box about how they would respond and what resources they might offer to Maramil?
People are sharing Call, an agency that works with immigrants.
Okay, perfect. So there's the New Americans Hotline, which can be a support. It's a toll-free multilingual hotline that provides live assistance in more than 200 languages. So that can be one resource if the person lives in a community where there may be community centers that cater to specifically to certain populations, reaching out and asking for help then. Really talking, again, going back to that survivor-centered model, asking Maramil, what do you need? How can I help you? Do we want to use Lima to translate?
Note, people are sharing in the chat that they will not use the child as a translator.
Okay. And that can be difficult, right? Because you've got this person there who can help you communicate, but it's really not safe or healthy or helpful to Lima to be in that position. And again, domestic violence services and programs can advocate. They may be able to find out, you know, what is her documentation status? What is her immigration status? How can we get her papers and things that are going to make her feel like she has some safety and some stability and maybe is less afraid to access services? So they can be really difficult situations. And so one of the things we really encourage you to do is reach out and collaborate with domestic violence service providers. I mentioned earlier, there's one in every single county. We're not expecting home visitors to be the experts, but we're really hoping that you can engage in that conversation, recognize that abuse might be happening, and respond by getting people the support and services they need and getting them to domestic violence services. Most counties have a local 24-hour assistance. There's also our state hotline and a national hotline. And we really encourage you in your own community to build relationships with your local domestic violence service provider. And there's lots of ways that you can do that. These are the services they provide. So they can provide crisis response, counseling. They offer support groups for victims of domestic violence. They all have local hotlines. Every county has an emergency shelter, housing. Many programs also have non-residential services, so they can go to court with you, go to the police station with you, help with maybe transportation. There's all kinds of things that domestic violence service providers can do, even if you're not living in shelter with that program. Advocating with systems, and they can help you safety plan, and you can put victims directly in contact with them, making those warm referrals, and they can help victims safety plan. So if you can establish and build that relationship with your local program prior to when you have a victim that's in crisis, that's always really beneficial. So if you can attend local task force meetings, if you can attend conferences on domestic violence, or that if your local program is maybe doing a conference or hosting a meeting, go, call, invite yourself to visit their program, to attend their meetings, invite them to to your staff meeting, ask them to come do a training, offer to provide training for them about how home visiting can help and the work that home visiting does. It's really about building those relationships with domestic violence programs so that when you have someone who could benefit from those services, that you already have that connection. And it's easy to pick up the phone and say, hey, I'm working with this really difficult case and I need your guidance and I need your support, or hey, this person I'm working with really is ready to talk to someone there. Can you put so-and-so on the phone? So what is one thing that you can do after listening to this webinar, part 1 and part 2, if you were able to attend both, to kind of, after this meeting or after our webinar in the next week or by the end of next week, what's one thing you can do to enhance your relationship with your local domestic violence program? And if you don't know who your local domestic violence program is, right, that's step 1. What's the contact information for my local program? Are people putting anything in the chat?
We have contacting local law enforcement to see if they have any programs happening, do some research to see what resources are available, call these resources and reach out.
Perfect. Those are all the kinds of things I want to hear. This is the New York State Domestic and Sexual Violence Hotline. And this is the link to OCFS website that lists all of the program by county. You're going to have in the resource guide that you're going to get after the webinar, you will have these links and these numbers. And of course, they're here in the PowerPoint as well. This is the text, call, and chat. So if people aren't, we found particularly during the pandemic that it was really difficult for sometimes people to access services. So we wanted to find ways to make that as easy and comfortable as possible. And we found that if people having the option of texting was sometimes easier and safer than phone calls. So we now, the state hotline now has the ability to do that and to do live chat in addition to the phone call. So you'll have all this information. SUNY Saver is a great resource. They, you go into the site and again, you'll have it in your resources. You put in your zip code and all of the domestic and sexual violence resources in your community will come up. This is available in language. You do not need to be a member of the SUNY community to use this resource. So this is just another great place to get connected to services that might be helpful to the families that you're working with. Okay, we can use the chat or again, I don't know if you want to unmute people, but if people have any questions or comments, I'm happy to answer them.
I think we're going to ask that if people have questions, Jen O'Connor, she's the director of the HVCI, I saw her pop on, and I and Bonnie as well will facilitate if people just want to put their questions in the chat box rather than having people unmute and speak.
I feel like I gave you a lot of information to digest today.
And to reiterate, as Bonnie said, I apologize, I forgot to mention this in the beginning. In the follow-up email, we will also include a resource guide with some things that Bonnie had been mentioning throughout the presentation, all in one place. People are just thanking us, very appreciative. I have a question, Bonnie, and I know we kind of discussed this when talking about building a safety plan, but a couple people were chatting throughout your presentation what to do immediately when a domestic violence situation, if it were to arise when you are at a visit, whether that be virtual or in person. I think the first steps are to assess safety, right? But I don't know.
And I think, and again, different agencies obviously have different practices and policies and procedures, but I have always been of the firm belief that if you are in a situation where you feel unsafe, you need to get out of that situation. And if you feel that you are leaving a family that's unsafe, and again, you always have to follow your policies and procedures, but I think calling 911 needs to happen. If there's a threat of imminent danger or violence, then you need to get out and you need to call people. And I think it's really important when you're thinking about your safety, really planning for, do I have access to, especially if you know the abusive partner's home, right? Sometimes we walk into a situation and I've had it happen to me. You go in and you're expecting what you saw the last 4 weeks and all of a sudden you're in a house and it is not looking like it did when you were there last week. And so kind of always being aware of, what are the exits? How do I get out? Does someone know where I am? Does someone know how long I expect to be here? But if you're talking about kind of imminent danger, you need to do whatever you need to do to protect yourself and the people in that home. And if that means calling 911, which again can be really difficult, sometimes people are really afraid to do that, but you need to protect yourself and that family.
People are also asking about reporting and how it's changed during COVID. I don't know if you want to speak to that.
Did you reporting?
Yes. How has there been more reporting now?
Oh, of domestic violence or child abuse?
Well, I know with child abuse reports we're finding that they're decreasing because they're not seeing their mandate.
Right. So, and I think in the beginning of COVID, there were sometimes initially less calls and we were thinking people don't have access, right? So then we started using the text and chat. And then as time went on, the numbers were increasing and increasing and increasing. So we saw hotlines and domestic violence programs and shelters saw a dramatic increase as a result of COVID. And it didn't come immediately as we first expected, But I think that was because people didn't have access. They were stuck in their homes with their abusive partner, trying to figure out, how can I even make a phone call? How can I access help? How can I get to the hotline? But absolutely a dramatic increase in what we saw, and shelters across the board, we saw a dramatic increase. And I know we didn't get to talk too much about in this virtual world that we live in. We talked a little bit about it last time, but again, that can be a place for safety planning, right? You know, if we're doing our visits virtually now, really trying to assess, you know, are you alone? Is it a safe place? Is it a safe time to talk? Is anyone else in the house with you? Now, again, there's no guarantees, right, that you're going to know 100%. But really at least trying to explore that with the family that you're working with, and being aware in your conversation and in your communications that you're really not sure who's there.
Absolutely. Well, I'd like to be mindful of time, everyone's time. It's 11:59. So as I mentioned, I will be sending a follow-up email with the presentation, resources, a link to the survey to fill out, and a link to our website where this meeting recording will be housed. Thank you so much, Bonnie. This has been a vital presentation to receive, and people are very appreciative and grateful. The chat box is exploding with thank yous.
Oh, I'm so glad.
So we will be in touch, everyone, with our next HVCI webinar offerings. Have a great day and stay warm and safe. Thank you, Bonnie.
Thank you.
Bye-bye.
Bye, everyone.